Assalamu alaikum everyone. I'm going to give you a lecture on poisonous organisms. Now, the organisms that you will be exposed to today has nothing to do with parasites, of them being parasites. However, as a future medical doctor, you will come across patients who has been exposed to some sorts of poison, and you need to understand the organism that had contributed to the poisonous action. So what is poison? Scientifically, poison are toxins that has poisonous substance. Normally, these poisonous substances are proteins. And who produces these poisonous substances? They are produced by any living cells or organism. The living cells that can produce toxins can be as small as a bacteria, or they can be multicellular organisms like insects and sea creatures. So for this series of lecture, you will be exposed to some sea creatures and insects with poisons which are medically important. Toxins that are present in these living creatures can be introduced into man via various mechanisms. When a toxin is injected into human, it is called a venom. Now, for bees, wasps, ants, and even snake, they have toxins and they inject their toxin into the prey or into human. When a toxin is injected into human or into the prey, the toxin is known as a venom, and the process is called envenomation. So why does these animals or these creatures have toxins? Well, toxins are used for killing smaller animals or prey in order for these larger animals or the creatures to get their food. Toxin is also used as a protection. With the presence of toxin, these animals or these creatures can use the toxin to get rid of the predators that want to eat them. Different kinds of toxins would have various effects on the victim or the prey. And the effects of the toxins would of course depend on the type of toxins. These are four general types or classes of toxin: cytolytic, being the breakdown of cell; neurotoxic means that the toxin works on the nervous system; hemolytic toxin would mean that the toxin will work on the cardiovascular system, mostly on the coagulopathy pathway; and myotoxic toxins would work on the muscle tissue, resulting in the breakdown of the muscles. As I mentioned earlier, toxins that are present in various animals enter the human via various modes. So if a toxin is injected, it's called a venom, and the process is called envenomation. If the toxin is located on the surface of the creature, and then the human or the victim or the prey comes in contact with the toxin on the surface of the animal, this can lead to dermatitis. Toxin within a living organism too can be consumed when the prey or when the predator or another creature tries to eat that animal. And when a toxin is consumed, it's called poisoning. The first poisonous organism you'll be exposed to is the jellyfish. Now, the common name for this particular jellyfish is the Portuguese man of war. This particular jellyfish is present in the waters of Malaysia. The scientific name for this jellyfish is called the Physalia species. The toxins of a jellyfish is normally located at the tentacles. What happens is, at the tentacles, you've got smaller structures called the nematocysts. And within these nematocysts, it contains the venom. These nematocysts contains small harpoon-like structures that it can sting and injects the venom into the victim. More often than not, a jellyfish toxin is neurotoxin. So if it is a small sea creature like a fish that the jellyfish wants to eat, it can paralyze the small fish. However, if it is a human being and the toxin is not too strong, then other neurological symptoms can appear as well as contact dermatitis. The sting from a jellyfish is extremely painful and there is a risk of anaphylaxis. Some of the presentations of jellyfish poisoning would be myalgia, which is aches and pain, shortness of breath, nausea, and lacrimation. Now, all these would be consequences of not purely neurotoxin, but other types of toxins as well. If it is a simple sting and clinically the patient is stable, the patient may just be given antihistamine to get rid of the itchiness and the stinging pain. In this slide, you see two situations where a human victim is being exposed to the tentacles of a jellyfish. You can see the classical whip-like pattern, the word whip over here, or it is also described as a fern leaf pattern. Now, this pattern is the consequences of the tentacles coming into contact with the human skin and the toxin being exposed to the human skin. The basic first aid for man who is being exposed to the poison of the jellyfish is to wash the area with vinegar. Vinegar is said to deneutralize or to deactivate the toxins from the jellyfish. This is an infographic of the types of jellyfish found in Sabah. This infographic was actually taken from one of the local newspapers here, and this is as recent as the last 5 years. So these describe the different kinds of jellyfish present in the waters of Sabah, as well as what to do when you have been stung by a jellyfish. The next poisonous sea creature is called the cone shell. This sea creature, or this particular shell, can be found in the waters of Malaysia too. The type of toxin present in this shell is the myotoxin, and this causes destruction of the muscle tissue. This slide shows how the cone shell has a specialized structure which has the venom at the end. The cone shell uses the structure that has the venom which it injects into its prey in order to get food. So man can be stung by the cone shell when man handles or picks up the cone shell from the ocean bed, or when we accidentally step on the ocean bed that has the cone shell nearby. There are many species of cone shells available throughout the world, and some of the cone shells that are available in the tropical waters have venoms which could be deadly to human beings. The structures that inject the venom into human, they have a hollow-like, needle-like structure which allows the venom to be injected into its prey. Because of its myotoxic nature, it can cause numbness and other local effect. And the worst case scenario would be paralysis and death. The other beautiful venomous sea creature is called the lionfish. Again, the lionfish is also present here in the waters of Malaysia. These spikes These fins that you see over here, they've got needle-like structure which can inject venom into its prey. Now, the venom that the lionfish harbors has neurotoxin properties. The next sea creature is the pufferfish. Pufferfish is also present here in Malaysia. It's got a neurotoxin, and the subtype of neurotoxin is the tetrodotoxin. Moving on from venomous marine organism, we will be talking about poisonous land animals or land creatures. This slide shows you a picture of the millipede. Now, you'll be surprised to learn that the millipede does have some toxins in it. However, the toxin is benign in that when it is exposed to human, it will only cause contact dermatitis. So the toxin present in the millipede comes in contact to human via skin. The millipede, when left unthreatened, is of no harm to human. However, if the millipede is crushed, a toxin will be released, and these are the types of toxin present in the body of the millipede. These toxins, when come in contact with the human skin, can cause dermatitis. So a person may suffer from simple discomfort to erythema, which is the redness of the skin, and if there is a mild reaction to the area, this may lead to scar formation. More often than not, no further treatment is required. This is just a close-up view of the millipede. Next poisonous organism that we will be discussing is called the centipede. I'm sure you're familiar with the centipede, and this is, of course, can be found in your own backyard. The centipede bites its prey and injects the venom into the prey. Therefore, envenomation takes place. Centipede can be found in dark and moist environment. So you can find the centipede under a pile of dry leaves or other conducive area. Centipedes are nocturnal feeders, so they come out at night looking for food. The type of toxin present in the centipede are the histamines, serotonin, and cardiodepressant toxin S. So when someone is exposed to this type of toxin, these are the symptoms that can take place. Although these symptoms can be severe, but generally the symptoms are mild, and the only severe symptoms are pain. So there's no antivenom that can be found for the centipede. So symptomatic treatment has to be given in order to relieve any discomfort the person is undergoing. In the next few slides, you'll be seeing some poisonous insects. The first order will be the Lepidoptera, and this insect would eventually become a butterfly. But the stage of development that is of interest to us would be the caterpillars, because it's got toxins on the body surface that can result in contact dermatitis. The next order of insects will be the Coleoptera beetles, and these beetles, when it is being crushed, when someone smacks the beetle, toxins will be released, and again contact dermatitis or skin irritation can happen. The third order of insects will be the Hymenoptera, of which we will be talking about bees, wasps, and ants. And the Hymenoptera insects will actually inject the toxins into the victim, hence envenomation takes place. This is the general taxonomy of insects that we will be talking about. The phylum is Arthropoda, which is the insect. The order is Hymenoptera, Coleoptera, and Lepidoptera. For Hymenoptera, there will be two superfamilies that we'll be talking. The first superfamily is the Apoidea, which are the bees and the wasp. And the second type of superfamily would be the Formicoideae, which are the ants. For the Coleoptera, we will be talking about the blister beetles, and the Lepidoptera will be talking about the caterpillars. So blister beetles and caterpillars will induce contact type dermatitis, whereas bees, wasps, and ants would induce envenomation, which is the injection of toxin into human. So let's discuss about caterpillars. I hope by now you would have been exposed to caterpillars throughout your life. So this is a type of caterpillar where we think it's hairy. It can be very pretty and very beautiful. However, these hair or spines on the body of the caterpillars has toxins on it, and when it comes in contact with our skin, it can release the toxin onto our skin and has some form of effects on the person. Caterpillars have spines and hairs on their body to avoid being eaten. So this is a survival mechanism of the caterpillars itself. The hairs on the caterpillar, they can remain intact on the caterpillars, or it can be airborne, which means that the caterpillars can shoot the hair onto the pending predators of the caterpillar. Some of the hairs are barbed or unbarbed. Now, barbed means that the ends of the hair has fish hook-like projection. This is to ensure that the hair of the caterpillars sticks onto the surface or skin surface or the hair surface or fur surface of the predator. Now, what is interesting, at the end of the hairs of the caterpillar, there are toxins present in order to irritate and to frighten the predators away. What happens when you come in contact with these toxins? In human, you might experience dermatitis, which is an inflammation that happens on the skin. The person may experience prickly sensation on the skin. Now, if the hair comes in contact with the eye, which is the conjunctiva of the eye, it can cause serious inflammation of the conjunctiva called conjunctivitis. For an individual who is prone to severe or exaggerated immune response, the person can express severe allergic reaction. Some caterpillar toxin can induce severe pain, very much similar to the pain of a bee sting. Now, what happens when you or your patient is exposed to the toxins or contact dermatitis from a caterpillar? You can wash the area with certain preparation, and you can wash the area with calcium gluconate or zinc oxide. If you suspect that the spines or the hair is still present within the area, you can move the spines or the hair using adhesive tape. In this slide, you see a caterpillar here crawling on the arm of an individual. Now, what happens is there are irritation or toxins on the surface of the caterpillar, and if you look closely, you can see the presence of urticarial rash on this particular individual. These are two huge urticarial response, and there are some small urticarial rash around the areas of the arm. Now, the rash in itself will result in inflammation, which is the urticarial rash, and it can be very itchy. The next order of insects is the Coleoptera insect. Now, this Coleoptera insect is known as the blister beetles. Blister beetles are found in abundance here in Malaysia. In this slide, you see an example of the blister beetle and an individual who's got blisters at the back of his neck. What could have happened is these beetles could have bitten or irritated the back of his neck, and he would have smacked and crushed the beetles while the beetles were on the back of his neck. The action of crushing the beetles would release the toxin present in the bodies of the beetles, and the toxins released irritates the skin, resulting in blisters. Blister beetles are generally plant feeders and can be found in abundance during the harvest season. As you would expect, the group who are at risk of being exposed to these beetles would be the agricultural workers. So these beetles could be crawling on their hands and their legs, and it will be smacked and crushed, and the toxins will then come in contact with the skin. Now the toxin is the cantharidin, and it can cause blisters within hours, and it takes about 2 weeks to heal. So when there is a wound, you must always clean and wash the wound regularly, and to ensure that there is no secondary bacterial infection. The next group of insects that injects venom into the prey is the ants. Now the ants come from the superfamily Formicoideae. This is an ant commonly known as the fire ant. The fire ants can be found throughout the world. It will use its mandibles and it will sting the victim repeatedly. So therefore, the victim can be exposed to the venom multiple times just from a single ant. Unlike a bee, it only stings once. The sting from a fire ant is extremely painful. The type of toxin is hemolytic and cytolytic. So it can affect the blood system or the hemo system, and it can also affect the tissues. Patient can present with erythematous papules, which may go away in the next 2 or 3 days. Some individuals who are very sensitive to foreign proteins can have anaphylactic reaction. So these individuals who are prone to exaggerated immune response can be given antihistamines. These are non-specific treatment. However, there are no antivenom present for fire ant envenomation. This slide shows the picture of a group of fire ants, and this shows the papules that are present on an individual's arm that has been severely bitten by fire ants. The next group of poisonous organisms are the bees. These insects would inject the venom into the prey. The bees' common genus are apis, and they've got various species, and generally these are the honeybees. This is a picture showing a beehive at a tree located above a tree branch, and it is present in the local neighborhood of this area. Bees, Apis indica and Apis dorsata, can be found throughout the world. The female bee is responsible for the reproduction, and the other bees are called the worker bees. The remaining female bee and the male bee are called the workers bees. Now they can be pretty aggressive in nature only when the colony and the hives has been disturbed. The sting of the bee is barbed in that once it is being injected into the victim, it is very difficult to remove. And there is a poison capsule or a toxin that comes at the end of the sting. Now, bee is interesting in that it only stings once. When the bee stings the victim or the prey, the bee will die. Unlike the ant, it will sting multiple times, but the bee will only sting once. Now, the venom of the bee contains histamine and some polypeptides as well. There is no antivenom available for a bee sting, so therefore symptomatic treatment will be administered to individuals who have severe response to bee sting. This slide shows the bee sting, the end of the bee sting, and this is what is meant by barbed. There are little protrusions that allows the sting to stay in place of the victim in order to ensure that the venom is being injected into the victim or the prey. This slide shows the various process of when a bee stings its victim. So what you see here is a bee that has just stung its prey or its victim. What you see over here is the sting apparatus. And this is the sting while it's still intact at the distal end of the bee. And this is what happens is when the bee stings or stung onto the victim, the sting apparatus will be released onto the victim and it will leave on the victim. So it will be removed from the main body of the bee. What happens is over here the structure there is a gland and a muscle that allows the venom to be continuously pumped into the circulation of the prey or victim. This is a photo of a person, or it looks like a child who's been stung with multiple bees. As you can see, the multiple lesions on this patient's skin. Another member of the venomous insect from the superfamily Hymenoptera are the wasps. Now, how do you differentiate between a bee and a wasp? A wasp has what looks like a waist. Okay, it's got the body compartment is separated between the head, the thorax, and the abdomen. So it's got a waist. Versus a bee is a complete whole structure. So if you see an insect, a stinging insect, which has the thorax and the abdomen is separated, so that is the wasps. Now the wasp genus is Vespa, very similar to or identical name and spelling to the motorcycle Vespa. Wasps can be very aggressive in nature, and they can sometimes be found in groups of wasps. Only the female seems to sting its prey or its victim. Like the bees, the sting is barbed and has a poison capsule as well. Now, the wasp stings multiple times its victim. So the wasp and the ants will sting multiple times, unlike the bee, which only sting once. The venom present in the wasps are histamines, hyaluronidase, and serotonin. So again, no antivenom is present, and symptomatic treatment can be given to victims or individuals who have been stung by wasps. The effects of bee sting and wasps are very similar. They can be very painful in nature and can last for over a whole day. Now, it can be as simple as having an itch at the local site of being stung, a wheal and flare reaction, which is a urticarial rash, and this can further become a blister. In a person who's never been exposed to any of these stings, the person may develop fever, hypertension, urticarial rash, and these symptoms. But the symptoms may vary from individual to individual according to the body reaction to the allergen that the person has been exposed to. If the bee sting is the second exposure, of which the body has already recognized the protein as a foreign body, a severe reaction can take place or can happen. And this severe reaction could be an anaphylactic shock, which could lead to fatality. And this reaction could take place within the first 10 to 20 minutes. In the event of an anaphylactic shock or in the event of an exaggerated response, an urgent steroids injection would be very, very helpful, and later on antihistamines can be given. Interestingly, a bee collector is said to be desensitized against the sting of a bee because there is chronic low-dose exposure to the proteins, rendering the bee collector desensitized to the bee toxin. This is a photograph of an individual who was stung at multiple locations with wasps. Now, it doesn't indicate whether it's one wasp stinging multiple times or several wasps stinging multiple times at different locations. The next group of insect that is poisonous to humans, or some of them are poisonous to humans, are the spiders. These are some of the insects, genus and species that can be poisonous to human beings. Now, the Electrodactylus geometricus is the grey widow spider, and this can be found here in Malaysia. Spiders in general can be found throughout the world. Not all of them are poisonous, some are poisonous. Most of the poisonous spiders are nocturnal feeders. Interestingly, both the male and female spiders are or have poison. If you are familiar with the black widow spider, the female is very, very poisonous. This is a photograph of a black widow spider. However, this spider is not present here in Malaysia. Again, this is another picture of a black widow spider. It's got the classical red streak on its body. This is a picture of the brown widow spider, which is present here in Malaysia. It's the Electrodactylus geometricus. Again, it's got the red streak at its underbelly, pretty similar to the black widow, except that it's brown. Poisonous spider bite is very, very painful. The poisonous spider in this picture is the tarantula. Tarantula is not indigenous here to Malaysia. So besides the venom available or present at its bite, it's also got some irritant hairs that it can shoot out onto the human. So the type of venom available in most of these venomous spiders are neurotoxic, so it can affect the skeletal muscle and it can affect the nervous system. So the tissues surrounding the bite of the spider can necrose, and this is called necrotic arachnidism. Because of the nature of the toxin present in this spider venom, which is mostly neurotoxin, this is the set of signs and symptoms that the patient can present with. It may start from a simple shortness of breath, which may progress to asphyxia, which is severe difficulty in breathing because of the nerve of supplying the diaphragm is affected. So patient is not able to breathe, and this can develop into a coma and eventually death. Of course, this is the severe or extreme outcome of a spider bite. Otherwise, a simple spider bite will present with pain and rash at the local site. Some of the spider bite can have other types of toxin like cytolytic toxin or cytotoxin and myotoxin too. And because of the presence of these toxins, the localized tissue will be affected. There will be severe edema and swelling in the localized area, and this could also lead to subsystemic effect. This photo shows a simple progression of the bite from a spider. This is the earlier picture of a spider bite, and eventually there will be severe edematous and blistering at the area. Now, if there's no treatment given, this tissue will necrose and it will die off, causing a necrotizing gangrenous tissue. This victim or this patient was bitten by a spider, perhaps somewhere at the side of the trunk. You can see the local reaction of the skin, the redness, the edematous, the inflammation. But when treatment is given within 24 hours, the inflammation subsides. When a patient presents to you with evidence of spider bite or a scorpion bite, first and foremost, you need to reassure the patient. You don't want the patient to panic, start crying, and going frantic over the bite of the spider or the scorpion. Now, you may want to give your patient some analgesia to reduce the pain the patient is suffering. Now, the analgesia group that you will give, you do not give them any form of narcotics like morphine, because this may encourage the spread of the venom systemically. One of the best ways to reduce the spread of a venom is to immobilize the area that was stung. You would also apply ice pack. This is, of course, to reduce the absorption of the venom systemically. In some parts of the world, antivenom is available. However, in Malaysia, we do not have antivenom against spider bite or scorpion bites. The next group of poisonous organism is the scorpion. Scorpions can be found anywhere in the world. However, only a small number of the scorpion species are poisonous. Now, the poison of the scorpion is located at the tail end of the scorpion, whereby there is a poison gland at the sting. The sting of the scorpion is called the talcin. Both male and female scorpions can produce poison, and however, the male is more poisonous than the female. These are examples of scorpion genus and species that are poisonous. This slide shows the male scorpion with the babies or the young ones on its back. Venoms from a scorpion consist of neurotoxins, cytolytic toxins, and cardiotoxins. They can exist in a series of combinations. And these toxins can be pretty severe to young children. And of course, the sting of a scorpion is very, very painful. At the site of the sting, edema can take place because local inflammatory response can take place. Because of the presence of these toxins, patient can present with muscle twitching and agitation. Fatality is normally due to neurotoxicity and cardiotoxicity. Because of the nature of neurotoxicity and cardiotoxicity, patient may have respiratory failure, perivascular failure, and myocarditis. A simple presentation would be nausea and vomiting. This slide shows necrotizing tissue at an area where the scorpion had stung the victim. This is because there is death of the tissue due to the cytotoxic agent, whereby the local tissue will die. Again, these are examples of necrotizing tissue. This is at the face, and this is at the upper arm. That's all. Thank you very much.